So thank you for having us today. Our ED staff, when they heard about your story, Elise, they were moved by it and wanted to show support for, our three hospitals. Let me take a step back and just quickly explain. Southcoast Health is comprised of 3 hospitals down in southeastern Massachusetts, St. Luke's in New Bedford, Charlton Memorial in Fall River, and Toby Hospital in Wareham. Michelle is our leader at the ED at St. Luke's. Teresa is our leader at the ED at Toby, and Shauna is our leader at the ED at Charlton. So when they heard your story, they, again, their entire staffs were deeply moved by it and wanted to do something, anything they could do to show support and to wish you well. And so the staffs got together and signed these T-shirts with get well messages for you.
Oh.
And just wanted you to know that that they were there in spirit with you. So love to have you come up and maybe take a look when you get a chance. But again, I think the entire ED staffs of our 3 hospitals would have loved to have been here to have met you personally. We all have wished you well in person, but these 3 ladies that are here today certainly represent all of those folks in spirit. So again, I think this support goes out to all of you as well, all of our colleagues in the ED and first responders here and security and everyone that each and every day are in similar situations. So again, I think we all want to thank you for everything that you do every day. We certainly understand from a first-hand perspective what it's like. So,
Thank you.
So I think if I can speak on behalf of the ED staff and some of the staff here, we want to thank you for reaching out. I'm new to the organization, and I'll tell you, I haven't met more exemplary staff than the ED staff that are here. And what you all as ED leaders experience every day across this country is nothing short of a miracle that people stay in this field. And the unfortunate event of Elise has brought a lot of awareness and hopefully will drive a significant amount of change across this nation for the safety and security of ED staff. So we thank you very much for coming here. I mean, it is really astounding that your kindness extends this far out, and I appreciate it for Elise, who I'm just meeting as well. So thank you.
This was an opportunity for the staff really to celebrate your courage and bravery through the events that you experience here in the emergency department. It was really very cathartic for the staff. It helped them work through their emotions of these events and how close it hits to anyone that works in the emergency department. So I was actually moved by how beneficial it was for the staff and how engaged they were, to show their support for you, in allegiance with, emergency nursing and anyone that works in emergency services. So please know that there was a lot of compassion and empathy and sympathy and cohesiveness putting together these T-shirts.
This is really amazing to me because when you see if a firefighter gets injured or a police officer gets injured, there's a whole brotherhood that goes to funeral processions, parades, what have you. This does not happen in the nursing profession as a general rule. I think this horrible incident that happened to me has just struck a chord with every nurse out there and every actual layperson out there who knows a nurse or is related to a nurse or has had any kind of contact with a nurse, because this could unfortunately happen to any nurse at any time. And the only good thing about all of this horribleness is that since then, myself and a few other staff members here have gotten involved in Boston with the agendas to try and get the healthcare safety laws passed, because they've been sitting there apparently in committee for Massachusetts for a very long time doing nothing. Now that they have a face and a name to put to it, it's kind of moving along like it got put on a train and it's going forward. So hopefully it'll get passed, and hopefully the takeaway I would like you to bring back to these people is that things are going to change. Things have to change, and I'm going to do whatever I can to make them change. And Carlton can tell you, he was just telling me on the way down, he's chief of security here, that some hospitals have contacted him to find out what we've done up till now, what can they do, where did they get things. So even without the law being passed yet, people are starting to think about, if this happened there, it can happen anywhere. And some places more likely than others. This was not a likely place for this to happen. You know?
Similar to Toby, where Teresa works, this is the same kind of size and location, but it's something that, you know, we've dealt with for years. We all know the violence that's in the emergency department, and thank you for being our spokesperson to make those changes in the on Beacon Hill.
Your work to make it safer for the nurses is going to make it safer for the patients also.
Correct.
And that's really, you know, your dedication to the patients coming back to work, the courage you show. We're all very, very supportive and very proud.
That's awesome.
Thank you.
And I felt it. I felt it from, it was coming from, through social media. It was coming through loud and clear from hospitals all over the place. And someone would share it, and they would share it to someone else, and it traveled. I had shares of ERs that sent pictures of support to me from Washington State, California, Texas, Florida. It was unbelievable. And I say, this is not a nursing thing. This is not what we do. This was incredible. Absolutely incredible. So I think we're just about nationwide now. So we're just going to run with it while it's got some steam behind it, and we're going to see what we can do.
We thank you for that.
Thank you. You're welcome. Yeah, thank you.
So we'd love to have you come up, Elise, and